Yeah, I'd be happy to introduce myself. And
let's see, we're ready. Anyway, we're honored to have you here. This is Stu Kerber, and he's running for hospital commissioner. And I will let him introduce himself. So,
yeah, I appreciate it.
okay.
Thank you very much. First off, thanks everybody for coming today. I really appreciate it. I know we all have a lot of demands on our time, and I sincerely appreciate everybody's engagement and just willingness to come out and listen to what I have to say. So my name's Stu Kerber, and I'm running for hospital commissioner, and I'm really excited about it. I Pacific Northwest native, and 9 years ago decided along with my wife to make Port Ludlow our home, and we absolutely love it there. And I'd say more intentionally than that, we're raising our two young boys here in the community. We've got a 3-year-old, Reese, and a soon-to-be 6-year-old named Urban, and they're a energetic ball of joy is maybe the right way to say it. And I'm really appreciative to have the opportunity to raise them here. I grew up in a part of rural Oregon that feels very similar to this, and so seeing their childhood and connection to nature and ability to do all the things that I enjoy doing around us is really special. I'm an avid outdoorsman, and I spent some time this weekend with them, helping them to build a fort in the woods by where we live, and those are things that I enjoyed doing as a kid. And I'd say as a father, I'm deeply invested in the future of our community, and at the same time, I've been looking for a way to get more involved in the community and truly to be of service and put to what I believe is a somewhat unique skill set to use, and one that I think benefits the hospital board. My professional background is in finance and also in organizational problem solving. I spent most of my career to date in commercial banking, and then for the last 8 years, I've been part of a small financial services firm. And really what we do is we work with family farms in Eastern Washington and help them navigate the challenges around generational change and around financial recovery. And one of the things that I've, just a side note that I've found, is that the agricultural industry, the landscape in Washington, unfortunately looks very similar to some of the same challenges that we're looking at in healthcare as an industry right now. I was very fortunate to be introduced to Jefferson Healthcare quite some time ago. My wife, Hillary Whittington, was the chief financial officer and chief administrative officer there for 9 years. And 5 years ago, she decided to pursue another career opportunity. But what that's done for me is it's driven more than a decade of what I call dinner conversations, and conversations not so much about Jefferson Healthcare, but really more about the state of healthcare in our country and how our healthcare system works and doesn't work, and how healthcare policy affects access to communities. And I'm really appreciative of that. And from that, I started actually thinking about running for this last fall. And my reason for doing so is that the more time I had these conversations and was thinking about healthcare and the landscape of it, I had this suspicion that the landscape was going to be changing, but more importantly, the challenges to healthcare in rural communities were largely going to be financial in nature. And I felt, and I still feel, that at this point in time, I'm the best candidate equipped to handle those head on and to really help to increase the technical ability of the board in some of these areas. I think that to date, the hospital has done an excellent job of remaining financially solid and at the same time driving access and care for our community. And one of the continued themes you'll hear me talk about is that I want to ensure that the hospital remains financially sound, but I want it to more than just remain financially sound. I want it to continue to drive access to our community. And the landscape that we're facing is a challenging one. We've got increasing expenses, increasing regulations, and at the same time, we're experiencing decreasing reimbursements, all which are going to be significant headwinds for our hospital. Professionally, I've come to you're fine to oh, you're okay. So professionally, I've come to this, I guess, belief in this concept, and it's not really a novel one, is that an organization can only take on as much risk as its financial situation or financial strength allows before it risks disrupting its ongoing operation. And with our public hospital district, Jefferson Healthcare, that risk really comes through in the community in the form of creativity. And that drives accessibility to our community for healthcare. And so let me just elaborate on that a little bit. If we think about the recent things that our hospital district has done, so for example, the 55,000 square foot building replacement and expansion in the center of our hospital, that not only was needed because of seismic concerns and other things about the old building, but it added space, which is adding new practitioners and new specialties that are meeting the needs of our community and driving access to healthcare. Another great example would be the hospital's entrance into the retail pharmacy space, which is somewhere not a lot of hospitals like to participate. Or even more so, I would say a great example is the providing dental care in a clinic-based setting. It is wrought with challenges for a hospital to provide dental services. And unfortunately, just to help explain this, our federal reimbursements through Medicare and Medicaid do not recognize that our teeth are connected to the body from a compensation standpoint. So it's been a challenge. It's a difficult spot for the hospital to operate in, but yet they were able to figure it out, and they've been the first one in the state to be able to do so in our rural community. So it's really pretty special. So when I talk about I want to ensure that the hospital remains financially sound, it's much greater than I want to ensure that the hospital is just here in the future. It's that I want the hospital to remain sound so that it can continue to take on risk to drive accessibility for our community. And I think that that's really important. If I'm elected, my goals are pretty straightforward. So I've talked quite a bit about I want to ensure the hospital remains financially sound. But I would also say along that, I want to ensure that it remains also secular and independent, because I think that those are critical to being a public hospital district. And I also think that those are attributes that really resonate and reflect our community. I also want to continue to solve barriers to accessing healthcare for all of our community, but especially for young families and for our aging population. And I think that our young families are the ones that really provide vibrancy to our community. And ultimately, they're going to be the leaders that step into our shoes as time moves forward. But at the same time, we need to ensure that our older population and older community members are able to age in place with grace and really enjoy the benefits of the community that they've worked so hard to build. I also see it critically important that the hospital remains not just an excellent place to work, but the place to practice healthcare in the region. And I think that that's imperative, because as the hospital continues to grow, the hospital will need to attract talent and retain it. And we're never going to be able to pay the highest wage, but we live in a beautiful place, and I think community and culture go a long ways in being able to attract talent. in the same way, I think it's really important that we retain the employees that the hospital has, and that the hospital is able to build those skills of the employees and promote them in place whenever possible. Because at the end of the day, our hospital district's most valuable resource is its employees. And without caregivers, access to care really means nothing. Lastly, I would say that from an objective standpoint, I want to ensure that I want to elevate the level of transparency at the board level, and also increase the level of professionalism at the board level. And this isn't a knock on the board, or and I don't mean it to. I don't want it to come across as disparagingly or anything like that. It's that I think the hospital looks very different now than it did a decade ago. And I think that there's the opportunity for the board to really level up its performance. I believe that high-performing organizations need high-performing boards because leadership starts at the top. I would also say that I believe that conflict or disagreement on a board is healthy. There should be disagreement on a board. But at the same time, that disagreement needs to be handled and resolved in a professional manner. And at no time should the staff, the hospital, or the hospital's reputation be disparaged in the public. I'm a strong believer that our public institutions work better when they're working together. And I see it largely one of the roles of a publicly elected commissioner is to be engaged, to be present, and to be accessible for the community. And that makes sense because a publicly elected commissioner in this setting for a hospital district is really the conduit between the public and the hospital district. Along those lines, I've spent a lot of time this summer reaching out and having meetings with different members of our leaders of our public institutions. So this would include city government, county government, law enforcement, fire chiefs, superintendents, executive directors of nonprofits. And my reason for doing so is a couple of things. One is I really believe in the importance of relationships, and I think that they're critically important when times get challenging. But I also was really curious, and I wanted to know really two things. One, what was the relationship with the hospital from their perspective? And the second thing was, where are there opportunities to either reduce friction or to collaborate? And I can tell you that largely the relationships are good in the community between the hospital and the other organizations. And I think that's what we kind of expect in our community is good professional relationships. But the other thing that I found is that there's a lot of really neat ideas that are sitting on the sidelines. And they lack an advocate or a champion to bubble them up and to drive them as part of the conversation and to explore them. And I really see that as a role that a commissioner can play. To be honest, it's something that's for me personally, it's exciting. That's a fun part of the role. And the reality is they're not all going to work, but there will be some that do, and the ones that don't will drive really fun conversations and hopefully drive access for our community. Lastly, I guess I would just say that I think that I understand what's at stake with our hospital district and our local healthcare system. And it's really, when we boil it down, it's our ability to continue with our way of life as we know it, and to live in this beautiful yet very remote part of the state. I truly believe that everybody should have access to healthcare, regardless of age and circumstance. And I'm running because I want to ensure that our hospital remains financially sound so that future generations can build their lives here as we've had the opportunity to.